Hello, and welcome to the Waldenstrom's Macroglobulinemia Patient Perspective video series. I am Sharon Piotrowski, and I will be your host. The information you will hear in this video series is from the perspective of WM patients and/or their caregivers. The goal is to share their unique perspectives, which may help someone else who has been diagnosed with this rare cancer. Please remember the information provided by the participants in this series is reflective of their unique journey. It should not replace the advice you are getting from your own doctor. This week, we'll be hearing from 5 WM patients discussing how they found out they had WM. Thank you to all who are participating for sharing your journeys. Let's get started. Welcome to the Waldenstrom's Macroglobulinemia Patient's Perspective video series. I'm your host, Sharon Piotrowski. This week's topic is to discuss how one found out that they had WM. I have Charles here with me today, and he's going to tell us about his journey to finding out that he has a rare cancer. Welcome, Charles.
Thank you very much. Nice being here.
Well, thank you so much for doing this with me. I appreciate it.
Yeah, well, a little background about my start on this adventure.
Well, actually, can I ask you a question first?
Sure.
When were you first diagnosed and what month and year?
February 1997.
Okay, so quite a while ago.
Yes. However,
Go ahead.
I was referred to the hematologist after my GP watched my serum viscosity go up for almost 8 years. So it took him 8 years to finally decide that he couldn't handle whatever my problem was, and he referred me to a hematologist at my local hospital.
So let me back up for a second. Who was the first doctor that you saw? Just a regular doctor?
Well, following my official diagnosis was with a hematologist.
Right, but before that?
Before that, I was just visiting my GP every couple of months, and we would do blood work, and he would say, "This is very strange. Your serum viscosity is well above 1." And by that time, it had approached 60. And by the time he said, "Go see a hematologist," I was at 120. So that's what
I have a question real quick. Sorry to interrupt you, but what's a normal level versus what you were at?
1.
Okay. And
1 to 3. We'll say.
And then why? So you said you were seeing him every couple of months. That's unusual to me to go. Did something prompt you to? Was it a regular exam that prompted him to start testing your serum viscosity? Like, that's strange.
Actually, after my initial blood work was done by his requisition, he decided to just follow me monthly. So at that point, I started monthly blood work, and I've been doing that for 22 years now.
So he had seen something on your initial blood work that prompted
Yes.
you to continue doing that.
Yeah.
And it seemed like it was your serum viscosity, correct?
Yes.
Triggering
That's
it.
right.
So over how many, I think you said 8 years of that?
Yeah.
Wow.
Actually, I did blood work. My work at the government involved some diving research work. So basically, I had to take government exams every year that were very, very comprehensive and included serum viscosity and a bunch of other standard parameters. And I was able to trace back, by getting hold of that blood work, back to 1989. And in 1989, I was in Goose Bay, Labrador, working on a project that involved looking at sediment slumping in a bay that's caused by earthquakes, except we were creating the earthquake with a large amount of explosives. And in the course of the field work, my rubber boot rubbed against my ankle and it turned into an infection. So our research vessel was lying offshore, and it was a very big one called the Hudson. And there was a nurse aboard. So I went aboard, and she gave me, what did she give me? She gave me some kind of a medication and then sent me back ashore. And after a few days, I noticed the red lines were climbing up my leg. So I hopped on a plane back to Halifax. And there, of course, I was given fairly strong medication to basically arrest the infection.
So did that finally resolve itself, the infection?
I'm sorry?
Did that finally resolve your infection and then you started getting infected more? Is that kind of the follow-up?
Yeah, that was like the trigger. Crazy, but that was the trigger that started the serum viscosity issue.
So during that period of time you were being tested for that, do you, now looking back, do you remember any other symptoms?
Toward the end, before I would say 2 or 3 years before the end, before I finally was referred to the hematologist at our local large hospital here, I was feeling fatigue. I was getting a little bit of bleeding, from cuts and things that didn't resolve quickly. But otherwise, I was in pretty good shape. I wasn't losing strength. All of this was happening, and even after I was diagnosed and was put on chemo, I was still in pretty good shape. I could still do lots of things that a normal person does without thinking twice.
So could I take you back a little bit? During that time, I gather your general physician did not test your IgM at that point. Were you tested when you went to the hematologist, oncologist?
That's correct.
And what was your IgM at that point?
My IgM was approaching 6,000.
Okay, so that kind of explains the bleeding a little bit, the problems with cuts and stuff like that. So now you go, and we're not going to talk too much about treatment, but now you go to this hematologist oncologist. I assume he runs tests and does a bone marrow biopsy. Is that correct? Did they do that back then?
Yes, they did. My hematologist turned out to be the head of my department at the QE2 hospital in Halifax. And he was in touch with a female doctor at the University of Texas at Houston. So once he explained to her some of my symptoms, she immediately said, do the bone marrow and basically we'll go from there. And the bone marrow was done and it showed WM.
Did you have to start treatment pretty much soon, right after you got diagnosed?
I had it about a month after I was diagnosed.
Okay, so pretty much after. Some people go, watch and wait. And now, forward, a lot of people that are in the 6,000 range don't necessarily have to have treatment, but it depends on if they're bleeding or they have other symptoms. So it's interesting you were able, they wanted to do that right away for you. I wanted to take you back though, because I hear this theme a lot in talking to people about their journeys, that it didn't interrupt your life though. You said you were still pretty much doing what you normally did. Is that correct?
Yeah, my initial treatment was a drug called 2-CDA. I don't know the long name for it. And it was delivered in a pump that I carried around on my waist for 2 weeks. And I haven't done that sort of thing since. But that was very unique. I'd never, of course, experienced something like that. One shower every 4 days with plastic wrapped around everything. But that worked very well. That gave me about... I'm sorry.
No, you go ahead.
That gave me about three or 4 years of relief. Brought my IgMs down into the low hundreds, maybe 300 or 400, but worked very well.
When you were before you were officially diagnosed, and you were still working, I gather, when this was all going on, that 8-year period. Is that correct?
I'm sorry. Say that again.
During that 8-year period before you went to the hematologist oncologist, were you still working?
Yes. In fact, I was working after.
Okay. And did this interrupt your life at all, even though you didn't know you had cancer at that point?
Not really. I guess the reason was, when I say I was working, I did an early retirement with a fairly good package in 1995, but I was given my office for life at the institute where I worked, sort of an emeritus designation. So I had a certain amount of support, and I was in 3 or 4 days a week, probably until about 2022. Then it dropped to 2 days a week, and now it's 2 days a week. So I kept at it and kept publishing and, dabbling in back burner stuff that I left lying in, not really paying much attention to, went back to it and looked at it again and published a couple of papers on it.
Well, you sound like you have an interesting career, which I'd love to go into more, but I have a couple more questions for you. When you were finally diagnosed and you found out you had cancer, how did you feel?
Well, the first thing that Dr. Langme, my initial hematologist, said, he invited me and my wife in for a session after it was confirmed. I said, Charles, when you come in, he said, I got to tell you this right off. You've got blood cancer, but you're going to die with it and not from it. And he was about 64 years old at the time. And about 8 years later, he was treated for esophageal cancer, but he died from it. Oh. But anyway, toward the end of our meeting, he stopped me as we were walking out the door and he said, you know anything about computers? I said, a little bit. He said, well, I'm going to be going to a conference in the UK on Waldenstrom's. Would you like me to bring back the proceedings? So this was my first mistake. I said, sure, I'd love to see them. When he came back, there were 3 volumes with 2,000 abstracts, okay? And he had asked me before he went, he said, do you want me to bring the CD or do you want me to bring the proceedings? And the critical error was, if I had the CD, of course, I just would dial in WM and it would make it what was about a 25-hour review of that stuff, about an hour and a half. Wow. So I did that for him for about 8 or 9 years until until he stopped practice because of his cancer.
How did you find out about the IWMF?
Very interesting. I have a home in Gulfport, Florida, which is about 1 hour from Sarasota. And I think I found it just Googling, but I found it very early, actually, while Arnie Smokler was still just sort of gearing it up, with a very small office and maybe 1 or 2 helpers. And what I did was, I think, I can't recall actually if I actually went down to talk to him, but he took my information and sent me a lot of stuff to read. So that was kind of neat. And what I did was I hooked up with the Sarasota subgroup probably a year or so after that. And pretty well every 1 or 2 years, I'd call them up and say, when is your meeting? I'd love to come down. And the reason that was kind of neat inadvertently is because there's always like a Dr. Trion or somebody or Hunter or one of the people that were into this up to their eyeballs up here in Boston who would come to this meeting, give a talk, do blood samples of some patients that he was interested in. And the whole thing was very comprehensive and very informative. So I got to know a lot about it just doing that sort of thing and reading all the IWMF stuff that came my way.
Charles, your advice is, I think, really good. And I think a lot of people are going to benefit from hearing that. So we're going to wrap this up. And I just wanted to thank you. And on behalf of the IWMF, myself, thank you all for watching today. We really appreciate your time. If you'd like to participate in future topics, please email me at wmpatientperspectivevideos@gmail.com. I encourage you to watch all the videos this week as each WM patient's journeys are unique and informative. Thank you all again, and I'll see you on the next video topic.